8 signs that may be early signs of renal failure. What seems to be a common symptom can be a sign of renal failure. The kidney is an organ responsible for excreting waste products in the body through urine. Located under the thorax, it filters large amounts of blood daily. It also helps balance important substances such as sodium and calcium. However, if you have a kidney disease such as nephritis, the ability to filter blood deteriorates and waste products may accumulate in your body, resulting in renal failure. Because it is difficult to be aware of renal failure in the early stages, it is often noticed after it has progressed to some extent, and as the symptoms progress, it becomes more difficult to treat complications. Therefore, it is important to be aware of any physical abnormalities that may be an early symptom. In this video, I'll introduce you to 8 signs that may be early symptoms of kidney failure. Number 1. Changes in urine. As an early sign of renal failure, urine and the frequency of urine may be abnormal. Because the kidneys are the organs that make urine, kidney upset manifests itself as obvious changes in urine. For example, you may urinate many times at night, you may have frequent urination throughout the day, your urine may be significantly darker, yellow-orange than before, or you may smell urine. It may become stronger and more unpleasant. Number 2. Swelling. Due to renal failure, the body's waste products cannot be discharged normally, which may cause swelling of the legs, ankles, face, hands, and abdomen. Oedema, which is considered to be a sign of renal failure, often occurs symmetrically, and if you press the swollen area strongly and for a long period, dents may remain. Also, if the swelling spreads throughout the body, water may accumulate in the lungs, so be careful. Number 3. Acne. Acne may occur due to the accumulation of waste products that are not normally excreted due to renal failure. These waste products are carried into the pores and upset the natural balance of the sebum, resulting in unpleasant acne. Acne itself can be treated topically, but be aware that kidney problems and illnesses can be the cause of acne. Number 4. Lower back pain. Kidney disease can cause pain in the lower back and on one side of the body. Pain occurs in these areas because the kidneys are located just halfway between the back flank and the spine. Pain in these areas is often confused with common muscle pain, but keep in mind that it can occur if the internal organs are inflamed due to polycystic kidney disease, kidney stones, or liver disease. Number 5. Nausea and vomiting. When kidney failure is the cause, nausea and vomiting occur because waste products in the body accumulate instead of being excreted normally. There are many possible causes of nausea and vomiting, but you may also want to consider the possibility of renal failure, especially if you have other symptoms. Number 6. Dry/itchy skin. As renal failure progresses, the body becomes dehydrated and the skin loses its natural moisture and becomes dry. This causes itching. In addition, the accumulation of waste products in the blood and on the skin can stimulate the itching receptors in the skin and cause itching. Number 7. Vertigo. Anemia may occur in patients with renal failure or kidney infection. If you experience persistent dizziness, lightheadedness, or intense fatigue, seek medical attention at the hospital. It may be caused by insufficient production of red blood cells in the body and insufficient oxygen supply to the brain. Number 8. Loss of appetite. If a person who usually eats a lot suddenly loses his appetite, it is recommended to see a doctor at the hospital. Kidney problems are not the only possible cause of loss of appetite, but the possibility should be considered. Hiccups and bloating may occur due to renal dysfunction. Caution: kidney failure can be treated if it is noticed early on. However, without medical examination or treatment, it can lead to further symptoms and illnesses such as high blood pressure, chronic swelling, and infections. If you have any of these symptoms, do not overlook them and see a doctor.